So I want to talk to you about blepharoplasty or eyelid surgery. Eyelid surgery is one of the most common surgical procedures performed these days. Patients often find that they have redundancy or new crepiness of the upper eyelids. They feel as if their eyelids are heavy, they feel like they look tired or angry all the time. The other thing that patients often do is hold their eyebrows up to try to correct that extra skin redundancy. When that occurs, not only are they holding the skin up, but they're also creating new creases in their brow, which can become another problem. The lower eyelids don't generally get as much crepiness or redundancy, but what you start to see is bulging all underneath this area. Some people think it's allergies that are doing that, but very often it's not. What happens is, as we age, there's what we call a septum that actually holds all the orbital fat, the fat that's around our eye, in place. As we age, that septum starts to relax and it'll start to bulge out. Very often you'll start to see fat protruding from this aspect, the medial aspect of the upper lid, as well as all along the lower lid. If that's happening, you may be a candidate for upper or lower blepharoplasty. Upper blepharoplasty is done either under local anesthetic, conscious sedation, or general sedation. The nice thing about an upper blepharoplasty is the incision line is hidden in what we call the supratarsal crease. It's the crease that everybody has when your eye opens. Right where your eye opens, there's a natural crease. That's exactly where we put the incision line. We take out the extra skin, and if there's any protruding fat, the extra fat from the medial fat pad. When we close it, it heals up beautifully. Generally, there's about a week to 10 days of redness in the area, and that's just from the incision, but it heals up very quickly and very nicely. Most people within a week can go back to work and nobody has any idea that there was anything done. The incision line heals beautifully and is in that crease, and so when you're looking at somebody, you can't even see the incision line. Lower blepharoplasties are done a variety of ways. There's what we call a transconjunctival blepharoplasty, in which the incision is made inside the lower lid, not on the eyeball, but on the lower lid. That's used to address fat herniation, what I was talking about before, where the fat is protruding all along the lower lid. The nice part about a transconjunctival blepharoplasty is there's no incisions on the lower lid, and you can go back to work the next day. The other types of lower lid blepharoplasties are the skin pinch blepharoplasty and the skin muscle flap blepharoplasty, and both of those are used to address different things. As I mentioned, the transconjunctival blepharoplasty is addressing just this herniation of the fat. The skin pinch blepharoplasty is used to address the crepiness or sometimes extra skin that's located along the lower eyelid. A skin muscle flap does two things. It addresses not only the herniation of the fat, but also festooning or the deep, deep pockets that sometimes people see along the lower eyelid. All of those blepharoplasty techniques can be done either in the office or in the OR, and they're each used to address very specific needs of each individual patient.